Communication Toolbox Module 1, Applying Therapeutic Nursing Communication Skills to Difficult Callers. Our objectives in this module are to apply traditional nursing therapeutic techniques to telehealth. We're going to define communication competence. We're going to look at the characteristics of quality communication. What is the American nursing definition of nursing skills? Telephonic skills, overview, listening, mirroring, and of course, please and thank you. So in order to elevate our communication skills, we need to understand the definition of communication competence. Communication competence and confidence, yes, refers to the knowledge of effective and appropriate communication patterns and the ability to use and adapt that knowledge in various contexts. In terms of psychology, a person's mood, stress level, personality, and level of communication apprehension, meaning how anxious they are about communicating with people, affect their competence. In telephone triage nursing, we need to understand good communication characteristics, so adopting those therapeutic communication styles. Speak calmly, speak clear, empathetic, have empathy, listen. Being a good listener is very important. I love this quote, nurse, just another word to describe a person strong enough to tolerate anything and soft enough to understand anyone. Telephone triage nursing has been around for 15, maybe 20 years, right? And nurses have been taking telephone calls over the phone without calling it telephone triage for decades. Now, the American Nurses Association definition of nursing skills embodies the telephone triage nurse. The A&E skills to be a successful registered nurse, they say you must be organized, of course. Telephone triage nurses have to be organized, they have to do their job, they have to talk, they have to type at the same time, they have to organize the thinking and manage the call. Stress management. Telephone triage nursing is very stressful. People are calling with complaints, pain, wanting prescriptions. Kindness and compassion, of course. Excellent communication skills, which we are trying to do with all these toolboxes. Dedication and patience. Detail-oriented. Critical thinking. Alert and observant. We're listening, right? We can't see. We don't have the luxury of seeing our patients. Being responsible. Well, of course, be responsible to be a nurse. Physical and mental endurance. Now, you wouldn't think about telephone triage nurses as being physically demanding, but you're sitting to 8 to 12 hours in a row, typing and talking. Call after call after call. This is very physically and mentally challenging. You're looking at a screen all day long with a headset on. You need to have sound judgment and decision-making skills. Now, although speaking and listening may sound a little elementary, it's the most important thing to being a good telephone triage nurse. So stating ideas clearly, communicating ethically, recognize when it's appropriate to communicate, when it's time to be quiet. Identify your communication goals. How can I help you today? Select the most appropriate and effective medium for communicating. So this can be chosen for you by your company, but it would be either a video call, a telephone call, that type thing, typing. Demonstrate credibility. Hello, my name is such and such. I'm the registered nurse calling you back from such and such office. Identify and manage misunderstandings. I'm so sorry you feel that way. Let me repeat. Let me try to reiterate what I meant in a different way, perhaps. Manage conflict. And that's what these toolboxes are going to be for when there is a difficult call. Be open-minded about another person's point of view. Listen attentively. Yes, okay. Take deep breaths. Taking a deep breath, especially on a difficult call, releases endorphins, which naturally fight the adrenaline that causes anxiety. Deep breathing. Channel your emotions into positive energy and motivation. Better information equals higher confidence. So by simply listening to these toolboxes, understanding, even if you don't understand initially, having that information can make you feel more confident on your call. Practice and get feedback from supervisors. So different telephone triage companies do this in different ways, whether it's peer reviews, supervisor reviews, listening to calls with you. Visualize success through positive thinking. Visualize the call going well. Number 1 telephonic skill, talk less and listen more. active listening is the key to a fruitful conversation, any conversation, especially with callers. Most callers complain about the same issue, but nurses need to lend an ear to it. Don't interrupt, even if you know where the conversation is heading. Nurses must be able to understand the problem from the caller's point of view. This may be the first time they've ever had back pain, even though you've heard a million back pain calls that end in them wanting a refill of pain meds or such and such. Pay attention to the tone and the emotion of the caller's voice. Are they giggling or are they really crying out? Build a strong relationship with the patient by allowing them to open up. Try to avoid interrupting when the other person is speaking. Telephone triage nurses have a set of questions they must ask and have answered to complete a protocol. Abdominal pain. Where's the pain? Does it radiate? Scale of 1 to 10. Describe it for me. We've got to get 3 of these things, but perhaps they want to talk about a surgery they had a year ago. This is very difficult. You need to try to rope them in if they go on too long, but try not to interrupt. Excuse me, you don't want to do those things. You want to try to let them finish as much as you can. Now listening, active listening, right? Everybody talks about this with telephone triage nursing especially. Listen to the caller, what are they saying, that sort of thing. But you're not just listening to the caller, you're listening to a tone in their voice. Are they in pain? An irritation? Maybe a baby crying in the background. You're going to listen with, I don't know, are they breathing okay? Listen with a purpose. Remember that you are trying to comprehend the patient's message and then assess its meaning. Reflective listening, by repeating back what the caller has just said, is a way to make sure you thoroughly understand the patient and is another way to display that you are truly listening. So you say the pain is on your left lower side of your abdomen, correct? Or is it more on the flank? Is it sort of by your belly button? Okay, now mirroring is a big buzz right now, right? So mirroring, especially in telephone triage, nursing, call centers, that kind of thing. So the belief is in order to build a rapport, mirroring a caller's tone communicates that you understand. So you're not going to answer a call and say, oh, how are you today? Oh, lovely, 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 if they're crying because their husband has passed. So Merriam-Webster defines rapport as a friendly, harmonious relationship, especially a relationship characterized by agreement, mutual understanding, and empathy. Good rapport makes communication possible, even easy. So build the rapport with strangers usually takes time, but telephone triage nurses don't have that time. And interaction on the phone, time is precious. So mirroring can build a patient-nurse relationship in minutes. Okay, now that should be common knowledge, but of course we're going to say it. Please say please and thank you, and you're welcome. Making a habit of good etiquette by saying please and thank you. Yes, sir. Okay, miss. Yes, ma'am. Mrs. So-and-so. It changes the approach to everything. The world of nursing requires avenues of kindness and empathy. Saying please and thank you, and having a positive feeling of gratitude and a positive natural force leads the call into telling them, I respect you, I'm trying to understand, I'm here, I'm listening. So now in summary, we all learn these things, right, before we pass the NCLEX. Be patient and calm, listen, show empathy, mirror, and please and thank you.